This presentation covers primary care and the options for refugees and other resettled populations in King County. So let's talk about what primary care is. I'm first going to talk about primary care more generally in terms of the U.S. medical system, and then I'll go into how it relates to refugees and other new arrivals that you might be serving. So basically, primary care is comprised of health services that focus on prevention, wellness, and treatment for common illnesses. You're likely to have a long-term relationship with a primary care provider, and you can think of this as this clinic as your health home, which connects you to other healthcare services should you need them. In the U.S. medical system, oftentimes you will need a referral from a primary care provider to get into any type of specialist care like oncology, rheumatology, cardiology. So your primary care provider sort of serves as an entryway or a gatekeeper into more specialized healthcare services. And then some examples of what services are covered under primary care. That includes screening for illnesses like cancer, keeping up to date on immunizations, and managing health conditions like diabetes if there's no complications, as well as annual exams. So now that we've gone over a brief definition of primary care, let's talk more about why primary care is important for refugee and other arrivals that are coming through the resettlement program. So first, it connects new arrivals with a medical provider in their community. And in most cases, it's going to be a provider who is close to their home and easy to access, which is really important. On top of that, when you're thinking about general health promotion, connecting with a primary care provider for longer term care and prevention helps keep patients healthier, which is really an important health goal for everyone, including refugee arrivals. Other than ensuring that clients are connected to health services to keep them healthy, which is obviously something that resettlement agencies want, it's also a core service requirement for resettlement caseworkers to connect new arrivals to a primary care provider. And that's just another reason why it's important to understand how this system works, and how it's a very different service than the medical screening, which new arrivals will also be connected to by the resettlement agency. And then finally, the overall goal is that after the resettlement period, when the client or new arrival is no longer connected to a resettlement agency, they will know who their primary care provider is and be able to access care independently. So now that we've discussed primary care and why it's important, let's go over the options for care in King County. So most of the clients that you are resettling will be relatively healthy and will not have complex health needs, in which case they can be seen at HealthPoint or another local healthcare clinic. I specifically mention HealthPoint here because this is a clinic system that has worked with resettlement agencies in the area for several years and has created a referral system to get new arrivals into primary care as smoothly and efficiently as possible. It's also okay to use a different local clinic, but in general, the VOLEGs in the area usually use HealthPoint. So cases that have complex healthcare needs will likely need to be seen at either the Harborview International Medicine Clinic for adults or the Harborview Pediatric Clinic for minors. And This can be a little confusing because Harborview in and of itself is a hospital system that has several different specialty clinics within it, but these specific clinics, the International Medicine Clinic and Pediatric Clinic, provide primary care. So they are a place that clients can establish primary care, and that will serve as their health home. So there would never be a case unless a client was being transferred between one primary care provider to the other. But otherwise, there would never be a case where you would have a client being seen at HealthPoint and one of these two clinics at Harborview at the same time, because those clinics are providing the exact same services. So now that we've gone over primary care provision in King County, I want to take a minute to discuss insurance and specifically the insurance plans that the clinics we've talked about do not accept. So there are 5 Medicaid plans in Washington, and you can see those listed at the top of this slide. They all provide similar coverage and services, and generally the way it works is once you apply for a new arrival, they will be randomly assigned one of these plans. Different providers are contracted with different insurance agencies, and so it's important to remember that HealthPoint doesn't accept United, and the Harborview Pediatric Clinic and International Medicine Clinic do not accept the Community Health Plan of Washington. You can change insurance plans. There's a couple ways to do it. One of the easier ones is at the bottom of this slide. But it's important to know that even if you are changing the insurance, it will not kick in until at earliest the first day of the next month, and sometimes later. In general, it's difficult for clinics to make appointments, if not impossible, to make appointments for clients that have insurance that they don't accept. Harborview's International Medicine Clinic and Pediatric Clinic can sometimes make exceptions to this rule if it's a very urgent case. But in general, communicating with the provider or the team that is going to see the patient, especially if it's an emergency or urgent visit coming up at Harborview, and sort of letting them know what the situation is with the insurance plan is the best option. And then you can create a new plan for that client together, either waiting for the insurance to change over or potentially having them seen while that change is occurring. To quickly recap what we've discussed in this presentation, primary care is important as a health home and for connecting new arrivals to the U.S. healthcare system. Both HealthPoint and the Harborview International Medicine Clinic and Harborview Pediatric Clinic are primary care providers. Connecting clients to primary care is a core service required of all resettlement agencies and also keeps clients healthy.